is multiple implants. Multiple implants have been placed. Say this is a patient. This is called, say, all on 6. There are 6 implants which have been placed in a very parallel fashion. And so the first option you're going to see here is this option. You can see multiple abutments. All these abutments are non-engaging. There's no hexagonal structure here. All are having round components so that it fits nicely. Because in a full mouth case, this is a model, so we have placed it parallelly, but in a mouth, the rigorous option happens in a very different way. For the upper, it always starts from the buccal towards the lingual side. From the anterior portion from the buccal to the lingual. So there'll be more of palatal bone, less of buccal bone. So we tend to place the implants very facially. So the components also needs to be changed. So in this case, if we assume that this is a very parallelly placed implant, you can see all the abutments and the non-engaging part. So, and also you could see this is actually a milled processes made of chrome cobalt. You can see the porcelain crown is it is attached to the frame directly, and it is very heavy compared with other processes, but it looks very aesthetic. So the thing is, you have to fit it on the crown, and this is the abutment screw. In the mouth, we need to just replace it with the screw. So if you see, we just have to place the implant, place the process on the crown, and all we have to do is just tighten the screw, and it will fit. So if you tighten it in one side, it should not lift. If the impression is proper, if the fitting is proper, that'll be passive fit. This is called passive fitting. So always when you tighten the denture, so you have to tighten it in a Z fashion. Suppose I tighten it here, you can tighten it here, then you can tighten it here, and then you can tighten this here, and then you can tighten this, not full tightening, but to the hand engagement. Then you can take an X-ray and verify everything is seated properly. Then you can give 35 Newton torque. You can give, or 20 Newton torque, depends on your manufacturer's indication. So this is the first option. Okay, this is option which we will give if the patient has got sufficient bone and sufficient angulation is done. Suppose you have a patient who have lost severe bone and also severe gingiva. Their option would be always a replaceable process. So this process is called FP2 process. FP1 is replacing only the crown. FP2 is replacing a part of the gingiva also. So this is one type of process. So the second option we have got here in the demo is we are having a removable denture with 2-bar framework. You can see this is a ball abutment. You can see this is a ball abutment. The close-up view you can see. So there is a small ball here, and this is our male portion. The female portion is inside the denture, and you can see the O-rings. These are all called O-rings. O-rings are nothing but small rubber cups, which will have grips. You'll have grip, and you can see the framework inside. This is a framework. The framework will be fabricated, and the denture is processed. It looks very aesthetic. And it'll replace both the white aesthetics and the pink aesthetics. So the patient will be given 4 or 5 implants before the mental foramen, and this bar is made up of titanium or chrome cobalt. If it is chrome cobalt, it is less cost. If it is titanium, it is more cost. And also, these components will help in the fixing of that. This is partially fixed for patient. During the usage, it will be fixed when they want to remove and clean. In most countries like UK, people prefer this because people are very hygienic, hygienic oriented, so they can remove this and clean it and put it back. And also, any problem is there, it is easily retrievable in this. It is easily retrievable. So this is one option. So if the same option, if we have instead of ball abutment, if we have locator abutment, you can see this is called locator attachments. So this will be very helpful. This will be very helpful for the fixing. You can see the female part inside, and this will be fixed on the top like that. So there will be a lock sound which will come. So these are the two options for people who have got grossly gross bone destruction. So this is another option you can see. This is a normal denture with a made up of telescope. This is called telescopic denture. So this is actually cemented on a root stump also. So it's a very simple way of replacing it. So now, because of implant, many people are not preferring this. There's not much retention, but stability will be there. So our retention factor is not there. Stability factor is there, and a little bit of retention factor is there. So what is this option? What is the options? What are the difference between? What is the difference between this and this? We have to see. So the difference between this and this is this, the crown, the framework, the crown, and everything is fused together. But here, if you see the tooth, these are all replaceable. This is called mallow bridge. If you could see, we can remove all the tooth. The first thing we can do for this patient when we want to give a denture option is, this is called a mallow bridge. It's a bit expensive. The first framework is fabricated with individual customized abutments on the top. But here, if you see, this is actually cemented on in the lab itself. The difference between this and this is, here the framework and the crown, everything is designed and ceramic is added and baked. But here, the framework is fabricated separately and the crowns are fabricated like how we are fabricating for how we used to fabricate for a normal denture. So the advantage of this is, you have to place it separately for each tooth. And the advantage is, if any crown fractures for this patient, you don't have to remove the whole thing. This crown alone can be removed from the patient's mouth, and we can always replace this part alone. So this is very, very advantageous because, as you know, removing the whole implanting out and putting it back, it's a big cumbersome procedure. Though it's expensive, this is preferred. And because this is made up of titanium, the weight is also less. So it is very, very useful for people who wants to have less disturbances in your setup. So the doctor who is going to do this will be always setting it up one by one. So they will be setting it one by one in the denture when they're fixing it. So it takes a very technique-sensitive procedure, and we have to correctly place it. You cannot place it one by one. So if you see, when I take it out all that, it is very difficult to identify the teeth. So we need to have a marking system and fix it. For a doctor, it's easy, but these are all done by the doctors. So these kind of systems have come nowadays. It's very, very good and very, very reliable. So suppose if one crown breaks in a denture, if something happens here, in this case, if something goes wrong, in this patient, then I have to remove all the screws and give it to the lab for correction. But here, this teeth cannot be removed. If say, for example, few teeth have been broken, I can just remove the only part which is broken. Say this crown can be cut and removed and can be placed back. Show how much these are the screw access holes. So it is actually screw in process. And the crowns are cemented using resin cements. So these are various options available for us these days in the field of implantology. And this is called a mallow bridge, or this is made up of milling. So it's wonderful and it's very nice. So I request all of you to understand the options available these days before you choose your right treatment, because understanding the process is very important. This is particularly for doctors, I'm telling, because choosing your crown, the process is the first thing in your implant success. So, dear friends, the one thing I just want to tell you is prosthetic success is very important. To conclude, we have discussed about so many prosthetic options for poor mouth implant. Now, if anyone has any doubt about any prosthetic option, feel free to contact me. I'm on my Facebook page.